So here you are one day afterwards, and the pain you had before your surgery yesterday, the back pain you've had for years, still there?
No.
Gone.
Gone.
Cured.
It was Deukmazing.
Deukmazing, I love it. He's got the new adjective. All right.
It was really good. It's amazing.
Okay, I'm here with one of my patients who is very patriotic. I love the shirt. And he had the Deuk laser disc repair yesterday, less than 24 hours ago. And here you are for your checkup the next day. How are you feeling?
I'm essentially pain-free. I feel great.
Awesome.
Such a big change.
Yeah. And how long did you have your lower back pain for?
It's been going on over 5 years now and getting progressively worse.
Now you have an interesting accent. What kind of an accent is that?
Well, originally I'm from a country called Rhodesia, which became Zimbabwe in Africa.
Okay.
But I've lived all over the world.
All over the world.
Yeah.
And you have had back pain for years. Have you sought any other opinions on getting it fixed?
Yeah, about 3 or 4 years ago I had a small laser spine repair in Tampa, which did a temporary fix. And then about a year ago I sought an opinion. 6 months ago I sought an opinion in Hong Kong, and they wanted to do a fusion of L5S1 and 4.5 as well.
Okay.
I wasn't happy with that idea, so I decided to come and look what other options were here.
And you found Deuk Spine Institute.
And I found Deuk Spine Institute a mile down the road from where I live.
Incredible. Huh?
Amazing.
I'm the only one that does this in the United States, and I happen to be a mile from you. Now, I did go to Hong Kong. I was telling you about 7 years ago, and they invited me to give a talk on the surgery you just had.
Yeah.
And I spoke to a bunch of orthopedic and neurosurgeons from all over the world in Hong Kong. It was a great talk, but unfortunately, it had no effect in terms of spreading the knowledge about the procedure. So I think they were just like, shocked and amazed, but then that was it.
Yeah.
Unfortunately, spine surgery is dominated by companies that make screws and rods and cages, and they make billions of dollars a year from surgeons putting those hardware in patients for fusions and artificial discs.
Yeah.
The surgery you had, we have no implants, no biologics going in you.
Yeah.
There's nobody making money on the surgery besides the surgery center that you went to. So there's no company that's driving the marketing, more of the procedures to be done like there is for these other companies. So you had a recommendation for a fusion at L4-5, L5S1. I want to make one more point. We tested your L4-5 and your L5S1 discs during surgery. You remember that?
I do. It was very, very painful.
And it was the pain you have every day, but it was just more intense, right? It was the
Correct.
same location, but it was more intense.
Mm-hmm.
Had you had the fusion at 4.5 and 5.1, do you think you would be pain-free right now?
I know I wouldn't have been pain-free.
Good, and why is that? There is a reason for that.
Well, you wouldn't have fixed the problem to start with.
Well,
and you would have done invasive surgery.
Yeah, but you had a disc at 3.4.
Oh, that is the thing that blows my mind.
Yes, that's the whole point of this conversation, is the surgeon missed that.
I've said to my wife at least 3 times today that it blows my mind that I would have had a spinal fusion and we would have completely missed
3.4.
3.4.
Which was the childbirthing disc. Remember when I asked you how painful it was? You said it hurts so bad it's like giving childbirth. So what we're talking about is the surgeon, and this happens all the time, folks, and this is one of the points of this conversation, why we have these conversations, is to learn from them. The doctor he went to in Hong Kong, I'm sure, was a great surgeon. They were going to do a fusion at L4-5, L5S1, but they weren't going to treat L3-4. And it turns out L3-4 was the source of his pain as well. He had 3 discs causing his pain, and all 3 were 10 out of 10. So this happens all the time where surgeons undertreat patients. They don't treat all the painful discs. They only treat 1 or 2. They leave the 3rd one, if there is a 3rd one, or a 4th one. What I found in doing research on treating patients like you over the last 16 years with laser surgery is that the average number of painful discs a patient needs fixed is 2.4, basically 2.5. You were a 3. discs that needed fixed because your pain's gone now, and we did 3.
Yeah.
So there are patients with 2, there are patients with 3, and the average is 2.5. So a lot of spine surgeons only treat 1 disc. Most of them, 90% of them, will only fix 1 disc at a time. So if the average patient has 2.5 discs that are painful and you're only fixing 1, that's why there's so many people who have back surgery. Even when the surgery is done properly with a fusion at the disc, that's why there's so many people with residual back pain, because they're undertreated. The surgeon didn't treat all the painful discs. Interesting stuff.
It was Deukmazing.
Deukmazing, I love it. He's got the new adjective. All right.
It was really good. It's amazing.
So here you are one day afterwards, and the pain you had before your surgery yesterday, the back pain you've had for years, still there?
No.
Gone.
Gone.
Cured.
Yeah.
It is cured.
It is cured.
Yeah, it's going to stay away as long as you do what I tell you to do.
Oh, I'm going to be very...
And you're not on powerful painkillers like narcotics right now?
No.
Yep.
You prescribed them, but I haven't taken them. I don't need them.
You had a Band-Aid surgery?
Yeah.
And here you are the next day. You went home.
Went home.
Right after the procedure, and here you are. Congratulations.
It's totally amazing. Yeah. Thank you very much.
Enjoy yourself.
Thank you.
All right.
Please thank your staff.
I sure will.